All right. Today, Dr. Joseph Ladapo joins us. He's the Surgeon General from the state of Florida. You can follow him. FL Surgeon. FL Surgeon Gen. That's where you get Dr. Ladapo. We also will have the First Lady from the state of Florida, Casey DeSantis. You can follow her on X, Casey DeSantis, and also hopeflorida.com. We got a lot to talk about. And then Tom Renz is going to drop by at the very end and give us an update on his observations from the standpoint of a country attorney that just seems to know nothing. That's how he presents himself. I've got a lot I want to get into. I'm very pleased that the First Lady and Dr. Ladapo are with us today, so don't go away.
Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for Christ's sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say.
I'm excited to bring you a new product, a new supplement, Fatty. I take it. I make Susan take it. My whole family takes it. This comes out of, believe it or not, dolphin research. The Navy maintains a fleet of dolphins, and a brilliant veterinarian recognized that these dolphins sometimes developed a syndrome identical to our Alzheimer's disease. Those dolphins were deficient in a particular fatty acid. She replaced the fatty acid, and they didn't get the Alzheimer's. Humans have the same issue, and we are more deficient in this particular fatty acid than ever before. And a simple replacement of this fatty acid called C15 will help us prevent these syndromes. It's published in a recent journal called Metabolites. It's a new nutritional C15, pentadecanoic acid it's called. The deficiency that we are developing for C15 creates something called the cellular fragility syndrome. This is the first nutritional deficiency syndrome to be discovered in 75 years and may be affecting us in many ways, and as many as 1 in 3 of us. This is an important breakthrough. Take advantage of it. Go to fatty15.com/Dr. Drew to receive 15% off a 90-day starter kit subscription, or use code Dr. Drew at checkout for that 15% off, or just go to our website, drdrew.com/fatty15. Please welcome the Surgeon General from the state of Florida and the First Lady, Casey DeSantis. Thank you guys for being here. So appreciative.
Thank you.
Yeah. And you'll see there's a little delay here. It's a little more than usual, I think. So if we step on each other, you guys keep going. I'll back away because I want to hear what you guys have to say. But Joe, although I'm looking forward to talking to you, I got to focus on the First Lady for a couple of minutes. Do you mind?
I get it. Thank you. I understand.
So, Casey, I want to hear, we're going to get into the MAHA material in just a second, but I want to hear about this government assistance, this new means of getting people off government assistance, and what is on your radar generally.
Yeah, sure. It's a brainchild that we had really when the governor was first elected back in 2018 and 2019. We traveled around the state. We met with a lot of people, particularly in the child welfare sphere, people who are running nonprofits or the local government or private entities. And we realized very quickly that there were a lot of people who were doing a lot of really good things within the communities, but they were very siloed. We also analyzed the way that people were getting help through government assistance. And what happened prior to the governor being elected is that if somebody needed help, they would come to government, they would get government assistance, check and payment if they qualified, and that would be where the story ends. But there's so many resources available in the community. What we wanted to do was to be able to make a connection with that. And so we reformulated the entire way that we help people in need. So now if you have a single mom who's coming into the government system, who's looking for food assistance, maybe SNAP or TANF benefits, what we do is we pair them up with a navigator, and that navigator is looking for resources exterior of government. So all of those nonprofits that are in the community. We're also the first state in the nation to embrace the faith-based community. So now if there's a mom who's having a hard time putting food on the table, we're able to do an immediate electronic alert to the participating faith-based communities within an area. They can see that and literally can deliver food to her front doorstep. So what government has done under Governor DeSantis and this administration is now we're bringing good people in need of help together with good people who are willing to help. And we've been able to transition off going on more than 33,000 people now off of government assistance, either partially or entirely. We've recruited thousands of churches, and we've really helped people on a pathway to prosperity and economic self-sufficiency just by utilizing pre-existing resources exterior of government. Because when you look back into the 1970s, when you look in, I should say the 60s, when you were looking at how Johnson was trying to retool things by doing this war on poverty, they really kind of changed it so people in need of help would go to government. What we're trying to do is to go back into the communities, because that's really where the help is, the faith-based community. The faith-based community has always been there, willing and able to help. They just didn't know where to look. And now we've made that connection, and we're helping thousands of people across the state.
So I am guessing that this has had a measurable effect on the homeless population in terms of numbers of people on the street, people getting help who have addictions and serious mental illness. As long as you hook them up with resources and bring them on in, they will get better and get off the street. Is that accurate?
That's right. And I think it's also knowing where to look. Again, there's a lot of siloed resources. There's a number for this entity. There's people can help in this way. Some people might not even know to look and to go into the front door of a church or even where to do that. What we've tried to do with this initiative is we have one phone number, one avenue, and basically it's an overarching umbrella. And underneath that are the resources with a navigator who takes on the onus of someone who's suffering. So for instance, I go back to that single mom or a single dad, they've got a lot going on in their lives. They're keeping down a job. They're trying to put food on the table, they keep the kids in school, help with the homework. It's hard to figure out where to go to find help. And it's hard to retell your story over and over again. And it gets demoralizing. But if you have somebody who's there as an advocate who will go out and fight for you, man, that's a game changer. And that's how you really help people on a path.
We used to call that a case manager, and we used to do that all the time. But California has completely undone all of that and made it impossible to help people in need. And they forbid any faith-based organizations being involved. Organizations like the Union Rescue Mission downtown here in Los Angeles, one of the best and some of the best outcome for homeless. They're vilified, they're marginalized, not only not supported, they're weighed down because, hey man, separation of church and state. That's the insanity of California. But again, when I go to Florida, particularly, yes.
From a government perspective, it is one of the greatest resources that we can tap into. It's their mission, but it's also free help, right? They want to be able to help. And the people that we've transitioned over to be navigators to help with all of this, they've been in government, some of them for 30 years. And they say they've never felt empowered to be able to make a difference. And actually, one of our lead navigators within the agency that serves children and families in need, the Department of Children and Families, said that she got a call from somebody in Washington State saying, hey, we see what you're doing in Florida. What can we do here? And she said, well, one of the things that we've done is we really embrace the faith-based community. We have the technology to be able to bring them into the fold, to have them show up at somebody's front doorstep with a plate of lasagna. And the lady out in Washington State said, yeah, we can't do that here, and basically dismissed it.
So I know you're supporting the governor 100%, but I'm looking at my chat stream here, and there are people asking for you to run for office. So maybe you can get going once the kids are out of primary school. I don't know. But
8, 7, and a 5-year-old.
You're making sense.
I pity the fool.
Yeah.
Whoever follows the goat in the state of Florida, that's going to be a tough hill to march.
But it's making sense. And for some weird reason, we've been unable to do sensible things in this country for a long time. And this state especially, by this state, I mean the one I'm stuck in, California. And like I said, I go to Southern Florida. I don't spend a lot of time in Northern Florida, but up in the Panhandle and Southern Florida, I just see young people thriving. I see people engaging. I see businesses opening. I see healthy people running around and doing things. And it's very different here, very different. And that gap is widening. So I want to hear about the Maha. Let's hear about the Maha story, because I also want to hear about where that gap began opening up was frankly during COVID. But talk to us about the Maha features.
Yeah, no, and I would say, this is the free state of Florida. I mean, everything that the governor has done, particularly during COVID, right? When other places like where you were locking down people, they were shutting down businesses, keeping some of the big box stores open, but the little guys, they were forced to shut down, shutting kids out of
liquor
school.
Stores.
Liquor
stores,
COVID
cannabis
mRNA
stores.
jab.
Casey, I'm going to correct you. Liquor stores and cannabis stores, they stayed open. So there you go.
Right. But the churches, they had to close, right? And, the mom and pop stores, who spent their livelihoods, their sweat equity trying to create a business that they're proud of, but they were told to shut down. And so the governor stood very strong. And because of his courageous leadership, I think he changed the trajectory of the entire country. He proved, that it can be done, that this stuff was a lot of narrative-driven agendas. So with the masks, saying, oh, yeah, wear this cloth mask, that's like putting a gnat in front of a chain link fence saying that you're going to stop it. There was no evidence to show that that was even going to be efficacious. And so, he understood and stood up and said, if you choose to do that, but that's not something that the state is going to mandate. And so as the result of that, listen, it's not just how he did during COVID. I mean, look at how he's managed a budget. He's paid down more than 50% of the outstanding debt since the state's inception. We have a 50-year crime low. He's done billions of dollars in water restoration and water quality. We're number one K through 12 education, number one higher education. I mean, people are coming here because it's the free state of Florida. We have no income tax. And right now he's fighting to reform property tax for homesteaded homeowners, which is very much needed here. And so if you want to talk about the free state of Florida, it's a really good foundation and people are very happy. I think that's why you guys in California were running out of U-Hauls, to be quite honest.
No, for sure. You don't have to be, it's just simply the fact. And we all know it. We're all miserable here. And we all know the state's being ruined. And, I was speaking to a French journalist on Tuesday, and he was talking about how the Europeans see the United States. And I thought, oh, yeah, it is the freedom. That's what makes us different. It is the freedom. And we can't squander that. And people are somehow afraid of the limits of freedom. And Florida has tested it. And guess what? It works. So talk to me about MAHA.
Okay. Yeah. All right. MAHA. So we started this, to follow suit and be a supporting factor for federal MAHA. And to try to really help with their efforts too. And the way I look at it is we're kind of doing it in various buckets, right? So one of it is we're really looking at health. What does it mean to be healthy? You would think that this would be cut and dry, but there's a lot of difference of opinions on what to eat, what not to eat. Some people like eggs, some people like meat, some people like just plants, whatever. We're trying to come up with what we deem as healthy, reimagining the food pyramid, doing an inverse food pyramid. And then what do we do as a result of that? I think there are things we can do within the school systems, looking at curriculum and standards that we have. We're going to look at the lunches and make sure that kids are getting good, healthy lunches. This is a good foundation for them to be able, to grow up and to be able to learn, what is healthy. We're also looking at tools and resources for parents to be able to use that within the school system. So if you're on a fixed budget and you want to know, if I only have $200 to be able to get through this week and next with groceries, we're working on resources to be able to give them options to say, okay, well, here's examples of recipes that you can use. Here's a grocery list that can fill that bill. And here's ideas of healthy things. And so we're trying to get in front of it and to try to give, as much information to folks as humanly possible. The other bucket is really the as the Surgeon General would say, kind of the poisons that are in food. This generally accepted as safe loophole that RFK Jr. has talked about quite a bit. How when you looked at a lot of these processed foods, how are some of these chemicals getting in there? And you see it's a giant loophole. And so we want to say, okay, from Florida's perspective, what can we do about that? To inform people about this. I mean, why in the world are there petroleum byproducts in sports drinks? But also, is there something that the state can do either statutorily, or is there something that they can do through the Department of Health to kind of empower people to know exactly what you're consuming? We say stay away from processed foods, right? But it's really about why, what's in it, and how problematic are these things that people think, the FDA must be looking at it. It must be fine. But when you find out with this loophole, the FDA doesn't even know a lot of the stuff that's winding up in our food supply. Right. And then also looking at vaccines and pharmaceuticals, as the Surgeon General has talked about. But we really want to, just from an empowering standpoint, help people make decisions based on truth And that's another thing, as somebody who's battled cancer, I remember when I was diagnosed and I talked to one of my physicians and I said, I'm relatively young. I have no pre-existing genetic disposition for cancer. How does something like this happen? And I remember him saying, it's sad. And I'm thinking, well, yeah, yes, it's sad. And he goes, no, standard American diet. And it got me thinking, what is healthy? What can I do to prevent going down that road, hopefully never again, or to help prevent somebody else from going down that road? And so it's hard when you look at studies that come out that might be funded by a company that has an agenda to sell a product, and then that's placed in a publication that is pay for play. So they are literally on the receiving end of funds to publish a study, and then you see it come up in a website, and it might be talking about, just kind of an example, like resveratrol is great, or do you drink red wine once a day, or is it bad, or whatever, and you don't know what truth is. And so I think that's one of the things that we're really trying to do is empower people with the truth to the best of our abilities to be able to make better decisions so that you can be as healthy as possible.
I am completely inspired by everything you have said today. I worry about us throwing the baby out with the bathwater. I'll talk to Joe about this in a second when it comes to the pharmaceutical companies, because, for instance, let's say you had presented with triple negative metastatic disease or something, and we have pharmaceutical agents to turn that into a chronic illness, essentially. But without the pharmaceutical companies making those medications and doing the research on those medications, people with cancers would just die. And the people are sort of forgetting that humans get sick no matter what. I mean, you live long enough, you get sick. That's the way it goes. And we can extend life with these fancy large molecules we have. But at the same token, what you said about the publication process and the research being adulterated is also true. So we have to find our way through this mess, and I agree with you, starting with diet, starting with additives, starting with living healthy lives. That is move number one. And I'm so glad you're doing it.
Yeah, I think, we did this cancer initiative, and that was one of the 5 tenets that we really looked at was the prevention. What can you do? I remember it was earlier in this year, maybe even last year, they were talking about coming out with a warning label on alcohol because it causes cancer. Well, okay, so that's something that I think people should be empowered to know to make decisions. Yep. And so what can we do to put ourselves in the best position to be able to not have to go down the road that I went through? And I think that, from a government perspective, even when you go back to the economic self-sufficiency stuff that I talked to you a second ago, that's really important because that is government getting in front of problems, trying to help people live either a healthy lifestyle or help people get off of government assistance to be able to live up to their God-given potential. And I think it's not typical for government to do that. They usually wait until there's a problem, then they act, then they spend too much money, and then there are worse outcomes and less accountability.
Yep. That's right. No, it's about human thriving. And thriving has a spiritual, physical, emotional, interpersonal. It has all those elements. And it sounds like you're going after all the fronts. And I so appreciate you talking to me today. I want to let you go. You've been very, very generous with your time. And if there's literally anything we can do to support any of your initiatives, I hope you'll call on us.
No, for sure. I agree. Thanks for having me. I appreciate it.
You got it. Casey DeSantis, follow her on X, Casey DeSantis. Joe, I'm going to flip over to you, monsieur. Thank you for being here as well. So let's talk about mandates and how people got so upside down on this notion that the job of government or even public health is to tell you what to do with your body. It's the oddest thing in the world to me. So tell me how you got to the point where you were able and courageous enough, and God bless you, smart enough to stand up to this tyranny.
Hey, Dr. Drew. It was great to hear Casey talking there. I'm inspired by her passion. And the wonderful thing about passion is that it brings vision and direction. And so she's doing something that really no one else we have here in the Department of Health, including myself, can do. And of course, I'm sort of support team, can bring scientific expertise, can bring clinical expertise, and I'm really excited about what we're all doing together, a co-creation. And, Dr. Drew, you mentioned, it's so interesting. And And it is really interesting that we've really had such difficulty really embracing the notion that public health's role is not to force people to do things. You've spoken very, very eloquently about the ethical issues with forced medical care. And, even beyond that, it's like a bad idea. It's a bad idea for trust.
It's just a bad idea. It's true.
It's a bad idea.
Aside from the bioethics, it's not good. Yeah, you're right.
Does it work to force people to do things? Yeah, but you're going to pay a price. You'll pay a price with trust. Frankly, you'll pay a price with loss of really people taking more responsibility for their own health in terms of being more conscientious about what they're putting into it and why they're doing that. So for so many reasons, it's a bad idea, but people are very much wed to it. Most of our colleagues are very much wed to it.
How has if you can speak to it, I've got a bunch of other stuff I want to get into with you, but how has the medical community has been very weird lately? Have you found support within the medical community? I'm asking that from a positive perspective.
I would say I have, and I think a lot of the doctors who, they're the minority of doctors, but a lot of the doctors who had trouble with the forced masking, a lot of the doctors who had trouble with the mask mandates, a lot of the doctors who had trouble with the shutdowns and the lockdowns and the censorship and all that, they appreciate the importance of autonomy, and we've gotten a lot of support from them.
Good. Yeah, I was, Dr. Ladapo, we were talking before the mics heated up, that I put out a tweet I sent to him where I just, did a simple search, how many countries have mandates? And turns out 88 of usually people's favorite countries, the Scandinavians, and, they don't have mandates for a vaccine. And it turns out 3 of 5 communist countries don't have mandates, including China. And by the way, China wants people to take vaccines, so they have lots of educational stuff and lots of incentives and blah, blah, blah. I have no problems with government doing incentives in education. That seems like government's role. But to say must fill in the blank, particularly when it comes to our body and what we're ingesting, I got a problem.
Yeah, I'm right with you, Dr. Drew. And, it's such a simple idea, and it makes so much sense. But people, in my opinion, there's just a lot of fear. There's a lot of fear that, that people are going to, people who aren't going to take any vaccines, which I don't think is true at all. There are other countries that, as you said, that don't have any mandates at all, but through education and, persuasion, information, they have pretty comparable rates of vaccine uptake. And there are countries that don't have any mandates that even have higher rates, some of them. So I think that there's really an unrealistic view of the consequences. The sky will not fall, I promise.
I want to ask you this: if I get into territory you don't want to talk about, please redirect me. But I'm curious what you thought about the Pfizer deal. Where my understanding is there was some $70 billion exchanged, that there is going to be increased access of medication for Medicaid patients as a result. And my reading of this whole thing was there is a hidden tariff in there, which is it's mandating equal cost for medication across all countries, which means other countries are going to go up. And that's going to be a tariff, essentially. And maybe we'll go down a little bit. And so I don't know. People were attacking it. There's so much distrust and anger towards Pfizer in particular that they want to throw the baby out with the bathwater. And I'm very, very, very concerned about that.
Yeah. And, I can't blame people at all. Me neither. This has been a very rough few years that people have, these last 5.5 years have been rough. So I can't blame people at all for being, very distrustful and very suspicious. Because Pfizer's not here for us, right? Pfizer is here for its own benefit and for the benefit of the people who own the company. Yeah. And we're not saying there's anything wrong with that. That's how the system works. But it's important to be very clear about that. So I'm with you. I'm cautious about being critical of it. It seems like potentially we're going to get some better prices. I know, obviously President Trump has a long history in business. He knows way more about it than I do. So I think to the extent that we can get better prices for pharmaceutical drugs in this country, I think it's great. That's interesting. You raised an interesting point. Are prices going to go up in other countries? I hope not. But I'm with you. I mean, I'm cautious. I want to get more information. Don't trust Pfizer at all. Yeah. But let's see if there's an avenue for us to get something good for Americans.
Well, let me tell you two. I'll say two things. One is, as a Medicare patient, I thought, I would love to go to one pharmacy where I get the best price and the government's going to give it to me, and fine. Because I think if Medi-Cal works, they're going to flip it over to Medicare. And most things I take are generic anyway. It's not these large molecules that cost $1 million. It is pennies in fact. But by the same token, I was telling somebody yesterday, I had a very serious AML case who had both AML and plasmacytoma and myeloma in the same case. And I had to use some very, very, I had to, not me directly, but with the oncologist, use some very serious Pfizer medication to wipe out his bone marrow, which we successfully did, and maybe even cured this AML that he had. And, this is life-changing, these medications. It's because of them that I could do that. There was not Pfizer, there would not be that molecule. And so I just, people forget, we're so focused on not getting sick and doing more with our diet and all these good things that I totally support. I don't want us also to leave out the fact that you and I are trained to save people from life-threatening and disabling disease.
Yeah, I totally agree with you there, Dr. Drew. And I think, that's where medicine probably shines best. I mean, we're as good as we are at, you come in with trauma from a motor vehicle accident or a skiing accident, or, you need some, an open reduction and internal fixation of your femur because of some biking accident or whatever. We're wonderful. As good as we are with that, is as bad as we are with the really kind of bread and butter everyday stuff. And I think it's important to recognize both. Like if your problems are sleep, mood, depression, weight,
exercise, muscle. Yeah.
We're terrible. I mean, we're really terrible, and it's because those things are really complex. Right. They have multiple contributors, and we tend to have a laser, right? And so we're just not able to take care of the body as a whole. But we are able to, we're able to fix that femur, and we're able to, provide that chemotherapy that targets the B cell lymphoma, and provide you with a stem cell transplant. So, it's I agree with you. You just got to kind of recognize it all.
We got to do both. We got to do both. And we're doing one poorly, we're doing one well, and the one that we do well, we're sort of like, ready to throw that away to do. It's just a mess. We've created a mess. We really have. And
it's a good point.
As I always say, it's on us. People don't understand. Yeah. And people don't get it. The opioid crisis, everything. It's on us. It's on the physicians. When they people are very worried about gender care. It's like, that's doctors doing that. We need to get the right stuff for the right patient. That's our job. And not by the way, mandate things and put people at risk of things where they don't get a benefit. There's so much we're not doing that is the primary obligation of our job. That's why I've been so worried about bioethics lately. It's weird. We're employed, or we're part of a system, or we're mandated from public health, and we lose track of what our real mandate is pay attention and make the call for the patient in front of us, given who they are, their family systems, their heritage, their religious, everything. Take it all into account and make the best call for that patient.
I could not agree with you more. It's so, it's so important. And, it's what makes it's what makes the best of our profession. I mean, and all of this stuff, it's getting eroded by, all the pressure that doctors feel for the high turnover, all the investment in, and with kind of care coordination that could be handled by someone who had less training. It's getting squeezed, and it's the most beautiful part of medicine when you're really there as a caretaker for a patient. So I agree with you.
And by the same token, I don't know if you noticed during the interview of RFK Jr. during his last stint in front of Congress, the Rhode Island senator was onto something. He said, we spend most of our medical costs at end of life. Last 2-3 months of life is where we pay all the expenses. And I was like, that guy, let's talk about that. We could use these funds much better if we could start to do a more dignified, more systematic, more realistic management of end-stage disease.
I think that's true, and I'll get a little radical here, Dr. Drew. I think actually we would have less of that if we were able to appreciate more of what we have while we're alive. Like, yes. I think that I don't know. Like, I mean, gosh, I pray that those years are many, many, many years in the future for me. But whenever they come, I just can't imagine myself. And, fortunately, I'm so blessed, wonderful wife, wonderful kids, wonderful opportunities professionally with my job. And I just cannot imagine, wanting to just really cram the end of my life with a bunch of, intense, crazy medical care. I mean, no, thank you. I've had a nice run,
but Joe,
and I want to enjoy whatever time there is left.
First of all, everybody, Joe Ladapo, real radical here. He wants to thrive and have a thriving, satisfying life. What radical ideas here. So, but it's because you and I know what that is. This is the problem. I've coached up my family very clearly. None of that for me, because I know what it is, and I know it's fruitless, and I know it's miserable, and I know it only causes suffering. But the average American does not get what that is. They just say, they're like, do something, make him better. And you and I know when we can and when we can't. And we have, anyway, that's a bigger topic, maybe for another day. I want you to go back to Maha and follow on to what Casey DeSantis was telling us, and tell us more about generally considered safe and what you guys are doing in Florida to make a difference.
Yeah, so she's got the vision and the fire for this area. And, she's like other people like, Robert F. Kennedy Jr., who, they just instinctively get this stuff. And, and other people have benefited from their vision. And so we have a number of initiatives that we're working on, and we're going to be rolling stuff out. So we're doing for example, some baby formula testing. So that's something that's happening where we're looking at some of the baby formulas that we buy as a state, because we have a program to provide baby formulas to moms who have lower income. And we're going to be looking at some other common foods that we give our kids. So, I'm not going to give away what foods those are, but they're really common things that we give our kids. And we're going to be doing some analysis for, different heavy metals and different other types of compounds. And then we've got plans with the food pyramid. So we're going to be talking more about that. We're hopefully going to be working with some schools also in terms of the food that they provide their students. So we've got a number of things planned, and it's all important stuff. And it's really as important as it is. It's just a reflection of how far adrift we have become as a society in terms of all these things that we accept as normal. And Casey mentioned that I use the term poison, and it is. It definitely is, especially for people whose physiology is just way more sensitive. Like, you can give, some kid one of these, some like muffin or pastry or something that's got some artificial colors and dyes and things, and that kid might be fine. You give other kids that, and they are spinning out, their behavior changes. It's poison for a lot of people. It's probably poison for all of us, but it's just more apparent in some people.
Have you heard of the construct of the dandelion versus the orchid?
I have not. Not familiar with that.
So I can't even remember where I saw it, to tell you the truth, but that I was listening to somebody lecture on exactly what you're describing. And he said, some people are like dandelions. They'll grow anywhere. You can do anything to them. They find their way through the cement and they go on. Other people are like orchids. You blow on them too hard and they wilt. It's like, so, and that's true. We have different biological sort of endowments, and we have to, families should be aware. But I think even
that's popping up on our stream
is what?
Vax injuries. And some people could take the vaccine and didn't get injuries. Some people died. Some people are still wondering, like, what can be done for the people that were injured.
Well,
is that too? I don't know if that's
that's not Joe's thing. Unless you have something you want to say on that, I'll certainly give you a chance. I got some ideas. It needs more research, is my idea.
Yeah. Well, yeah, no, I agree with you. We've actually worked some with this group. I don't know if you're familiar with them, React 19, and they've got really terrific leadership. Brianne Dressen, Dr. Walskog, and other people who are part of the group. And, they specialize in advocating for patients with vaccine injury. And I know that they are interested in research. They're interested in advocacy. We need to be doing a lot more, and not only on the research side, but the advocacy side and the testing side. Not just with there's been a lot of attention to long COVID, which is important in my opinion. I know there's controversy, but my experience from hearing patients who shared with me kind of their how they felt afterward, I'm totally convinced. I mean, I believe that that they are suffering, and it's long COVID, and then there's this idea of long vax. Dr. Holland Krumholtz at Yale has led this work with some researchers there. It's a thing, and every day that goes by, I just hope we really do. NIH can kind of muster some resources to really dig into this more.
Yeah, in terms of what can be done, there's lots of different ideas. There's some people are using antivirals, some people are using statins, some people are using nattokinase, and there's Dr. McCullough has a protocol out there that he reports good success with. I've heard many different stories, but there's no sort of one. We need to get more publications, bottom line. I know McCullough's trying to publish his data, and I know that Dr. Patterson, whose name comes up occasionally in the Senate hearings, trying to publish his, but you can't get the journals to publish this stuff. That's the other problem, is it gets pushed down. So I don't know. Any event, listen, it is a delight to see you flourish there in Florida. I am, as you know, a big fan. And when you make a decision, some people have really good judgment. And you are one of those people. And when somebody with good judgments makes a call that even if it looks like I don't understand why he did that, assume there's a good reason and look carefully before you start to question what Dr. Ladapo has chosen to do. I don't know where you've been wrong, my friend. I'd like to see, and you've taken heat for various things. I want to know where you've been wrong. And by the way, I'm certain that if you were wrong, you would adjust course immediately and admit it.
Yeah. Thanks.
Exactly.
Thank you very much. Those are kind words. Those are very kind words.
It's good to see you. Again, I really want to come out to Florida and shake your hand. We're down in the South all the time, and Florida is a big stamp state, and it's hard to get over there from the southern cities. But I will. Or if you're up here in Southern California, please let us know. Okay.
You bet, man. You bet. Next time I'm out there.
All right. All right. Say to your wife, too.
People seem really happy in Florida.
Oh, people are very happy in Florida. Thanks, Joe. Appreciate it.
All right.
People are very happy in Florida because it's, as Casey DeSantis was saying, it's the free state of Florida. And I had a sort of an epiphany. I had an epiphany when I was walking in Skid Row about 7 years ago. Michael Schallenberger was with me and a few other people. And we were at the Union Rescue Mission and we were talking to people in there. And the staff was reporting on all their cases. And I went, oh, it is truly all here. It's addiction. You've not mentioned one thing except maybe one serious mental illness. Otherwise, it was all addiction we're talking about here. That homelessness is addiction. That's the thing. I wish it's something I suspected, but they confirmed that. Same thing happened to me the other day, talking to Andrei Berkov here in this program. And he said, we have envy and disdain for the United States, us Europeans. And he started talking about what they envied. And I thought, oh, it's the freedom. It's the fact that our founding fathers set up a very careful system to protect our freedoms. And yeah, we go a little goofy with our freedoms and we can test the limits of it. But ultimately, it is that mandate of freedom that must be protected. And Florida has taken that very seriously, and it is what they're calling the Free State of Florida. And just go examine how happy people are there. And the fact, I didn't want to say this in front of the officials, but the reality is that we have a spiritual problem in this country too, and they're allowing for sort of addressing that issue as well. So good. It makes us better. Let's see. I'm looking at your... Yeah. I see all your restreams here. I see what you're talking about. Tom Renz coming in. He's got some things on his mind.
We're just goofing around about water. Don't pay attention.
About water?
Yeah. I don't know. It's...
People, and also I've noticed that the people on TikTok, they like drop in on the live stream and they really aren't caught up. Dr. Drew is not an anti-vaxxer in the slightest. That's not what we're talking about. We're talking about bodily autonomy. We're talking about informed patients. We're talking about my body, my choice. That's what we're talking about.
I didn't even know we were on TikTok. So hello, TikTok.
Somebody pissed off Caleb.
Oh, Caleb's offending us. Yeah, no, I for the record, if you're not up to date, my elderly patients were all vaccinated and boosted. I just took issue with whether a 20-year-old male should be getting a booster or not, given that they have zero chance of Omicron hurting them and a non-zero chance of the vaccine hurting them. As a physician, I then can't recommend that. But you can take it if you want, and I want to protect your freedoms to do so if that's what you want to do. And I have questions about the hepatitis B vaccine. I'm still not convinced why we're doing that. Please convince me.
Does it cause autism?
But maybe, what?
Does it cause autism
that would be a nice,
babies?
But I don't understand why I'm recommending it to a 1-day-old. I understand why I might recommend it to a 14-year-old or a 10-year-old.
If they're traveling to a foreign country or something?
Chronic hepatitis B pretty much only exists in immigrants from endemic areas, Asia. And guess what? The vast, vast, vast majority of them are identified if they get pregnant. You're going to check for hepatitis B. And those children, they get hepatitis B on day one, no problem. But the rest of us, why are they getting it? They can take it later, no problem. Okay, Tom Renz, up to this.
Going to heat it up.
I've spent most of my career dealing with illnesses that shorten life, and now we have ways to extend it and extend wellness. I've been working with the team over at V-Shred to develop a product that has everything I want in a longevity supplement. NR Boost has nicotinamide riboside. You know how metal can rust? Well, your body behaves in a similar way. It's mediated through something called NAD. NAD falls as we age, so we're less able to fight off that oxidative process. We oxidize much like that metal. And NAD fights it, but nicotinamide riboside elevates NAD so we can push back on those oxidative stressors, improving health, improving longevity. The other product is Senosync, has fisetin, one of the key molecules to fight off zombie cells, and we've added resveratrol to that, which is a well-known anti-aging antioxidant again. I don't like supplements that have a ton of ingredients. To me, it suggests that none of it's working. When I prescribe a medication, I prescribe that medicine because I expect that to work. That is exactly what I've done with these products. And I want you to go to drdrew.com/vshredmd for 10% off. Again, that is drdrew.com/vshredmd. The Wellness Company knows that taking charge of your family's healthcare is a top priority, and being rationally ready, and who knows what the future will hold for us. Now, TWC has a service to cover your family's medical needs, including and especially prevention. For just $100 a month, the One Wellness Elite membership includes 2 free medical-grade nutraceuticals per month, free prescriptions for over 800 of the most common medications, access to concierge telemedicine, available at a moment's notice, and a 15% discount on all supplements and the emergency kits. 15% off the emergency kits. That's quite a saving. So if you're spending $100 or more on supplements and meds every month, this plan will already save you money. If you sign up for a year, you'll save $200. And when you use the link, drdrew.com/TWC, you'll get 10% off the first payment to the One Wellness Elite membership. Check out One Wellness at drdrew.com/TWC and get 10% off your first payment. drdrew.com/TWC. It's all there.
That's brilliant. And thank you, Drew. Where's Dr. Drew? Where is he? Dr. Drew. Dr. Drew.
And don't forget that One Wellness. It is really a great plan out there. And don't forget the drop. People are using that to lose weight. I used it. I had a little side effect. My sleep was a little disrupted, but it helped with my appetite management. Oh, my mic cable's off again, I guess. And Paleo Valley is also innovating, bringing new products to the market. Use drdrew.com/Paleo Valley and you'll get 15% off your first order and 20% off when you subscribe. We spoke to their team this week and just learned that you guys like most the grass-fed and finished beef sticks. So do I. Well, no, it's between that and the beef bone broth for me. In particular, the classic and the summer sausage. Those are mine. These not dry. They're delicious sticks. They have higher levels of omega-3 fatty acid than conventional beef. They're naturally fermented. They're juicy and they pop when you chew on them, when you snap them. There's a snap there. Zero sugar, zero artificial preservatives, zero gluten, soy, or corn. Paleo Valley is a wonderful small business that promotes health, clean eating. Also they support obviously this show. Get 15% off your first order, drdrew.com/Paleo Valley and 20% off when you subscribe. And what I love dearly about Paleo Valley is their founders they truly are so careful with everything in their products. They really are trying to create something good here. So support Paleo Valley when you can. And you won't be sorry. Susan was saying something the other day. She was talking to someone and said, we use these products every single day. I eat beef sticks. I eat the bone broth. We are. I just ate. You left a lemon meringue bar out here. I ate that last night. So we
like the juicy beef sticks.
All right, my friend and frequent flyer here, Tom Renz. You can find him on X at Renz, R-E-N-Z, Tom, okay, and TomRenz.com, and then TomRenz.substack.com. I will save him the intro and just say he's some country lawyer that doesn't really know anything and yet seems to fall into material that gets his ass in a sling because it turns out he does know something. Tom, welcome after all.
I'm glad to see you, Doc. I don't know much, but you mentioned Pfizer, and you know how much I love them, right? I mean, yeah, I might know a thing or two about that, but not much, just a little.
So let's help me with that. Let's start right up front with my conflict on this, which is I was talking to Finnerty about this yesterday. He was like, but what about that? I need an apology and I don't trust Borla. I said, yes. I totally agree. I want an apology. I want them to fall on their sword. But in the meantime, I've got a guy with AML and I got to use one of their fancy large molecules to save his life. How do we reconcile these two things?
Well, you put Anthony Borla in jail. And you find a new CEO and you do what you ought to do if you follow the law, right? So, I mean, Doc, let me ask you a question. If I came on this show and every time I was here, I lied to you, if I come on this show again, would you trust me? I mean,
no,
the answer is I don't even need the answer.
Before we do that, but I know, but lying requires a knowledge of misdeed, right? You have to know you're lying without justification, number one, and then you're distorting the truth. Is it possible, let me just, again, this is just by way of discussion, that he was getting information? I mean, I don't know what his background is. Is he a businessman? If he's a businessman, I could see easily how he could be misled because it gets complicated.
Well, let's say he is, right? So in the 2019, 2020 SEC reports, Pfizer admitted that mRNA is a gene therapy product, yet when it came out, they said it's not a gene therapy product, it's a vaccine. It's a biologic, it's this, it's that. Of course it's a gene therapy product. You're putting a genetic material into someone's arm for a therapeutic purpose. Of course it's a gene therapy product. And then I made I'm not very good at this, but once in a while I get a little intuition. I thought maybe someone might ask, well, but maybe it's just a mistake, right? So I looked up and I got a little list here of major scandals and controversies involving Pfizer. And honestly, if I listed them all, we'd be here for about 15, 20 minutes, which we don't have that much time. But we've got, a $2.3 billion health fraud. We've got fraud again, fraud some more, and fraud again. How many times does a company commit fraud before you start saying, well, wait a second, these guys are liars, I don't trust them? There are 700 or more pharmaceutical companies in the United States. So let's say for a second that I was okay in trusting Big Pharma. Well, there's 699, at least more of them that we could have done a deal with or promoted, rather than parading the guy out who is selling a product contaminated with SV40 that causes turbo cancer, including SV40 enhancers, according to at least one study out of Europe, which can't be there by accident, and who, since that product has been released, has bought a couple cancer companies and made a couple other business deals to be more involved with cancer. I mean, I'm not saying that these guys knew they were causing cancer and then bought a bunch of companies so they could treat the cancer and profit off the disease that they're making, but maybe, just maybe, we ought to ask the question, instead of making a $70 billion deal with this guy that's not public, and I got to be honest with you, Doc, I'm a big Trump supporter. This to me, this deal means one of two things, because it can only mean one of two things. Either Trump is the dumbest man in the planet, or he sold out, because you cannot make the argument that this company that, like I said, they lied about the efficacy of this vaccine. I mean, just talking about the COVID vaccine, because that's my specialty, right? But they lied about its ability to stop transmission. They lied about its efficacy. They lied about side effects. They lied about everything. We got the Pfizer papers. No one's talking about shedding, which was still in their Pfizer papers, and we know is a legitimate concern, but nobody's even studying it. This company has lied to us, and then we have dozens and dozens of other scandals. When do you trust a liar? You don't have to be a genius to think this through. This is just common sense. And, I'm not a doctor. You guys are all smarter than me. But I've got a little bit of common sense, and this is just the kind of question we ought to be asking. Why don't we reward one of the 699 other companies that didn't screw America?
I get you that that Pfizer is certainly at the head of the list, but I just looked up big pharma companies who had severe billion-dollar fines and or convictions of fraud. And the fraud is Purdue, GlaxoSmithKline, Johnson & Johnson, Pfizer, Abbott, Eli Lilly, AstraZeneca, Bristol Myers, Merck. That's the top. They all have been convicted of fraud. And then billion-dollar fines, Novartis, Sanofi, Teva, Gilead, Amgen, Allergan, Mallinckrodt. That's pretty much everybody. So what this suggests is that Pfizer is not an outlier. They're just part of and it makes me, and this is why I looked this up, because I have a feeling the problem isn't the companies, it's the system we've created that the freaking companies are operating in that is sort of rewarding fraud or requiring manipulation and lobbying and craziness and persuasion of doctors where they should have no relationship with us. You know what I mean? It's a system problem, not just a company problem.
It is. So shouldn't we find the few companies that haven't been convicted and reward them? Why do we perpetuate the system?
Listen, I'm going to tell you, I'm just looking at this list. That pretty much exhausts the medications I use. So there's no deal to be made if there's no medication that I need.
Well, but Doc, we have the lowest life expectancy of any developed nation and spend way more than any other developed nation on healthcare on the planet. So maybe, just maybe, instead of rewarding these frauds, we ought to be going after them criminally and making them accountable. And maybe these medications Doc, you and I went over the COVID stuff. And when we went through this, there were a number of times we disagreed, but I kept bringing evidence, right?
Yeah.
So let me ask you the question. Do you think as a doctor that if you take a guy like me and you say, you know what, let's take a look at this drug from Pfizer, and you sick me on it, do you really trust that they're completely honest about any of these drugs? Because I don't trust a liar. And I'm not saying they're all bad, and I'm not saying they don't work. I'm saying that shouldn't we have some accountability for the fraud, for the lies? Because what we have and what this looks like to me, and Doc, we just went through cancer in my family. When I followed what the doctors were saying, we got down to a 6% chance of survival. They told us to put on palliative care. They said, you're dead. And when I said, go to hell, I said some other choice words, and then did my research the way that I do it with the doctors and the scientists and the naturopaths and alternative healers. We cured it. Right? So now I'm not going to say that works for everybody, and I'm not going to say I recommend that for everybody, but I'm going to say that maybe, just maybe, when the system is structured for people to be rewarded to create treatments, not cures, for people to perpetuate illness and make people sick, and they make more money when they do that than when they cure them, maybe we need to start with some accountability rather than rewarding and exacerbating the system. And what we did here was we made a deal that says we're going to give you more money to keep doing the same thing.
Okay. There's a lot packed into what you just said. So I want to try to address each step along the way. Your first question was I'm aware of it, but I can't look at the camera and make notes at the same time. So your first question was, shouldn't we try another company? Happily so, but they just don't make or have the medications I need. And so you asked, do I trust the companies that have been convicted of fraud? No, I don't. That's why I do careful research. Now, we have a big problem in this country right now where I used to rely on the medical research to make these determinations. I had no relationship with the drug companies. I use the medical literature. That now is adulterated. That is gravely concerning. That is to me, that's one of our biggest problems. And I'm seeing RFK Jr. go after it. He's going after it. He's very systematic. He's going to go after that. I think he's going to get that one done so we can start to trust the medical literature again. In terms of accountability, absolutely, there should be accountability. Personally, I'd be happy with an apology. Just start with that. Just an accounting of what they got wrong. But you're saying that there should be legal consequences. I don't disagree necessarily. Again, I worry about us disabling companies that we need, but okay. And then finally, your question is, what about, and I hope I hit all the highlights. And by the way, when we disagree, it's the greatest thing in the world for me. I don't get to have calm, gentle conversation of disagreeing with anybody anymore because everybody condemns each other when they disagree. You're good at discourse and argument. It's good. This is healthy. But my fast point is I'm involved in cancer research, and trust me, if we could come up with a cure for prostate cancer, holy shit, would we be happy with our research? Oh my God, we keep aiming for that. But guess what? Cancer is brilliant. Cancer is brilliant. And so as soon as we find a way of eradicating all the cancer in the body, one cell evolves in such a way as to evade what we were doing, and that one takes over. Now, we can direct stuff at a second mechanism to try to go at that evasion mechanism. If we can figure it all out, half the time we can't. But cancer is I swear to God, Tom, I would be an oncologist if I were back in my early training days again, because we are doing so much. Back when I was in training, when I was in residency, I would look at oncologists and just go, what's wrong with you? Why are you doing this? Everybody died. You can't do anything. Now we can do an awful lot. And that has been, at least the phase 3 trials have been funded by the pharma company. There you go. I mean, yes, and I don't trust them. And yes, they maybe have some sinister motivation. And yes, they're prone to fraud. And yes, our system sucks. But I don't know. We got to solve this part. So keep going. Tell me more about argue with me on all this.
Well, so here we go. We're going to start on, first of all, I want to throw this one out there just because I want to cause trouble. And this is just going to get me in all sorts of trouble.
Okay, go ahead.
So I love Bobby. I love and appreciate Bobby on every level. But I mean, is it a real surprise that his hands are tied when we've got Susie Wiles as chief of staff, who works for, still has not renounced her position as a managing partner at Mercury LLC, a company that represented, not her, but the company represented Pfizer, Gavi, and a bunch of other places. You got Pam Bondi, who worked for Pfizer, though, you know, not that long ago, well, actually for a law firm representing Pfizer. But I mean, there's conflicts. There's conflicts there. And I've got an issue with it because I see Bobby, and we all know Bobby's history, but we all see Bobby looking like his hands are tied. And I'm saying that without no confirmation from Bobby, nothing from him. This is me speaking on what I'm observing. It looks like the guy's hands are tied. We have the data, we have the evidence, and Bobby's a good lawyer. He wouldn't put it out there if he couldn't back it up as with evidence. So I don't like that. I will say that on the cancer front, though, and by the way, Doc, off air, I'd like to talk with you sometime. I got an introduction for some really interesting people doing some research. I'd love to get your take on.
Love it. Yes,
they're doing
a
some
lot of
great
interesting stuff going on, and you got it. And again, one of the really horrible weaknesses in our system is I was just talking to Casey DeSantis about this. If somebody's not making money off the research, it's hard to get it funded.
Yep, 100%. Well, more importantly, if someone like Big Pharma is going to lose billions of dollars like they would if we got anywhere, they make sure that certain things aren't funded and certain things are perpetuated. So, I mean, you and I know, so there's a test, and there's actually newer tests out there, but there's a test, it's an FDA approved test. It's called DATAR, GPX, and they pull circulating free-flowing cancer cells from your blood. They culture them, and then they test. They do a bunch of things, genetic testing, all sorts of things, but they also test various interventions against it. See how much it kills, right? And doing that, you get a good idea. Hey, this chemo might work better. This alternative treatment, God forbid, might work because they test those too. That test is hidden. It's not shared. And if you ask a hospital to run that test, I did. I ended up paying out of pocket. They didn't do anything. They wouldn't do anything, and I could barely get them to look at it. But you find out, hey, wait a second, the chemo that my loved one or myself that I'm being treated with isn't even the right chemo. And by the way, this alternative has a higher kill rate for free-floating cancer cells in my body than the chemo does. Now, I understand, and I may have read a little bit about cancer when I was going through this stuff, that, it does evolve. It's a very complicated, very tricky thing. The thing is, though, is we're not even using best available evidence to deal with it. There's technology, there's science, there's all sorts of things out there. And now we're moving towards Pfizer, of all people, and others, creating an AI doppelganger of you based on your genetic information so that they can test various drugs that they're going to try and produce in 48 hours or less based on this AI. I mean, for God's sakes, am I really going to trust the guys that gave me the SV40 contaminated vaccines that caused the turbo cancer to come up with a solution to cancer in 48 hours or less that's untested outside of through an AI system that they built? Hell no.
So talk to me. Let me see if I can find that list again here we are, of all the companies that got convicted of billion-dollar fines and fraud. I'm literally everybody's on this list, which actually kind of surprising to me. And they're not all American companies, by the way. There's a French company in there, and a Swiss company. What the hell?
Well, what do we do about it? Because some of these medications are critical. Like, I'm anti-pharma at this point, and I got to tell you, Drew. I mean, 2019, I was as pro-vaxxed as could be. My kids were up to date. Everything else. At this point, I wouldn't let them bring a needle near my kid's arm. They'd have to shoot me first. I mean, it'd be self-defense. I don't trust any of it. And I went back and I looked at all the studies that did this. I looked at all the things just like Bobby did, just like a couple other people did. And I got to be honest with you, I would be happy to argue against pretty much any of these drugs, in a courtroom, because they're just, the science behind them so bad that a lawyer like me can see the issues. So, I mean, if that's the case, I've got to ask myself, which of the drugs on the market have science that I can actually trust? And I'm not saying that none of them work, right? At least for their stated purpose. I'm saying that how many of these drugs that do work for their stated purpose cause unknown or unlisted or not mentioned adverse events of special interest or side effects. And Drew, did you know?
Well, these are, when somebody's dying, Tom, you take big risk, right?
Well, I know.
Like I said, I just treated an AML plasmacytoma combo successful with some very powerful big molecules from Pfizer. He'd be dead by now. Could those medicines cause other cancers? Could they cause liver failure? Absolutely. He got a serious infection, ended up in the ICU, and this is what happens. You make people sick with these medicines for sure, but you end up with somebody that's going to live a bit longer, hopefully a lot longer. And just, that's it. That's, this is all the time when I treat cases like this. It's not like I wonder, are these medicines going to work? They work. And they make people sick and dangerously sick sometimes and cause secondary malignancies sometimes. We're dealing with somebody who has a life-threatening disease for sure. It's not a maybe. For sure. And one that has there's no naturopath, there's no non-allopathic, there's nothing for these kinds of leukemias and things. You're a goner. Yeah. So
100%.
Me do?
100%. Doc, listen, when you look down the barrel of a gun, you have to make a decision. Do you stand there and run the risk that they're not going to pull the trigger, or do you try and move the gun? Right. And it's a no-win situation. I mean, you're just praying either way. So I get that. But I have a solution. I got a recommendation. This is radical. And I am at the risk of being a crazy man. I suggest that Congress, for a change, pass a one-page bill, and it covers this crazy idea. I suggest that they pass a one-page bill that defines informed consent in a way that's very broad, and then requires that all patients be given informed consent on their drugs. Because I don't know if you're aware of this, but did you know that there is not a single informed consent law on the books for approved drugs in this country? Did you know that all of that is through civil, through common law, through different things like that? The idea of informed consent is not actually on the books in any sort of meaningful way in this country anywhere. So why is there not an informed consent
help me with
law?
that? Yeah, that's terrible. I had no idea. We all behave as though informed consent is part of our mandate. By the way, there's a group running around now who I like, who is trying to come up with I don't consent forms. I do not consent to forms, which I would support that too, right? We should have both. Yeah. We should have a consent to this. I don't consent to that. So yeah, I'm with you, Tom. Let's do it. Let's get that bill.
Well, Doc, here's what they did. They co-opted you. And I don't mean that in a demeaning way. I'm honored to know you. I think you're a brilliant scientist, and we can talk. That's the wonderful thing that we got is we can disagree. But here's the thing, Doc.
Yeah.
Very tricky lawyers and very manipulative people who were making a lot of money co-opted good doctors like you. And what they did was they told you, well, you have to provide informed consent for your patients. But they don't have to give you informed consent. Let's look at here's how I found out about this, right? So the COVID vaccines, right? You got page after page after page of issues.
Nobody got informed consent. Nobody got it. Nobody.
There or anywhere else. Yeah. Because here's the deal. You got page after page of issues.
Yeah.
Well, but you know what they do? They called them adverse events of special interest, not side effects. They call them different names. They do different things. But these are things that, I mean, listen, the myocarditis, thrombocytopenia, all these different things that we now know are happening were listed in the FDA's serious adverse events of special interest that they intended to monitor list that occurred or that came out in, I believe, November of or October of 2020 before the jabs were released. So what they've done is they've made you feel like you're getting science. You've got peer-reviewed journals that, as you so rightly pointed out, were co-opted, bought, and paid for. You've got bad science on bad science on bad science. It's corrupt. We need to put some basic laws defining the science and the requirements.
I mean, science has been adulterated all over the place. I had a enthusiastic mind meld with Brett Weinstein about this. We were both like lamenting that scientific method isn't being taught anymore. The basic instrument that we are supposed to use. No. It's a very delicate instrument, the scientific method, and it's. I judged some papers recently, and I had to ask each publisher, do you know what a null hypothesis is? What was your? Do you understand what the scientific method is? Did you apply some sort of hypothetical standard starting? What were your assumptions? Nope. Here's the data. I got data. And data is just, you can do anything you want with data. That's not scientific method. Yeah. That's not the instrument. It's observational, and it may be informational, and it may be something we could try to derive from it, but that's not science. But we're on board. We end up in the same place, right? You and I, which is kind of fascinating. And it seems like every time we end up in the same place. But I got to kind of wrap things up. But before we do, I want you to tell me about what you reposted about Congressman Eric Swalwell. That I saw that, and it gave me a chill. Just the video that Caleb plays in the opening of this show, I could get, according to Swalwell, I could get targeted and investigated. Help me with that one.
Yeah. Yeah, well, I mean, you could, because our justice system is the only thing that rivals the corruption that we see in the healthcare system. I found that firsthand during my fight. COVID, prior to COVID, it's not like I'm a big shot. I'm some guy from a little town in Ohio. So prior to COVID, I'm doing my little thing. I had no idea about this. COVID comes along. Suddenly, everybody knows my name. I'm doing these things that people are, like you were talking to me about. And it's, they get this big stuff. But I'm also seeing mind-blowing corruption in the justice system. Mind-blowing. And I'll tell you, Doc, you tend to be more moderate than me. I tend to be a little more right-leaning. But I'm going to say this to you because I think that it's something that needs to be said. I, for years, always felt, I've never met a racist judge or lawyer. And so I would hear for years and years and years, our black brothers and sisters saying, hey, we're getting the short end of the stick in the justice system. Well, how can that be, right? How can that be? And so, I'm thinking, no, justice is blind. It's this, it's that. I've spent the last few years doing what I'm doing. One of the things that's been most profoundly apparent to me is the disparity in justice for those that have versus those that don't. If you can hire me
for sure.
with O.J. Simpson money, I can get you out of the glove don't fit, you must acquit, right? If you give me the money to do that, I can get reasonable doubt on about anything you want to give me because I'm a shady lawyer, right? If you're a good human being who did something stupid, you don't have any money, and you go to the public defender because it's all you can do, and God bless the public defenders, they do yeoman's work, but they've got several hundred cases per defender. You're going to get about 30 seconds of their time. I mean, and that's all that can be done. You're not getting an adequate defense. And this translates, right? So what we saw, and regardless of how you feel about this, I posted evidence on this. J6, mark my words, we will eventually see that this was a planned stage thing. It will come out. We're going to see more and more evidence coming out about issues with the election system. I mark my words. A lot of these things that we saw, we saw people persecuted for talking about. We saw moms and dads who were speaking at school board meetings persecuted. Now we see the Trump Justice Department going after. Well, okay, I'm sorry. Pam Bondi hasn't arrested anybody, so I can't say anything good about that. But we see them investigating and looking into other things, right? We see them looking, kind of into the other. It's like the shoes on the other foot. Now, I don't think that the current Justice Department is doing much of anything, so I certainly can't argue that they're weaponized. But just looking at some of this is causing these people to have shivers run down their spine. Well, you don't have to fear justice if you're not a crook, right? But that's the problem. And one of the things that we're seeing is that when the power of the U.S. Justice Department comes against you, they have no budget. They have infinite lawyers.
Right.
And so it's the OJ defense on steroids. They're going to come after you. Yeah. You're going to lose. And that's, Swalwell's openly admitting that if he gets the opportunity, he's coming after people like me, like you. I mean, they've been coming after me anyways, but they're going to come after people like you and everybody else who had the courage to let someone like me speak. the courage to speak themselves. You've questioned the narrative, Doc. I mean, you don't come at it from as hard of an angle as I do, but you question the narrative. You're a legitimate scientist. You actually ask questions. They're going to come after that because they don't want you to question the narrative. They don't want truth. And they're going to try and criminalize truth. And they're already starting. And this ties into the tax on free speech and everything else we're seeing.
Well, a couple things. There is not a difference between the corruption of the justice system and the corruption of the healthcare system, right? I would have been less open to the idea of the justice system being corrupt if I hadn't just seen it in the healthcare system so vividly. So it's the same. And in terms of truth under attack, I mean, we're seeing it in Europe, right? I mean, that's where we're going to end up if we're not very, very careful.
Well, I've got a document. I had whistleblowers give me from the federal courts during the height of COVID, right? So I had whistleblowers from everywhere. Mm-hmm. And I've got a document from a chief judge or head judge in one of the district courts and this court had within its scope, it had COVID cases before it. And I got a document from from the chief judge who I can't say for sure he was presiding over any of those cases specifically at the time, but going out to the entirety of the court, saying, friends don't let friends go unvaxxed. I saw thousands of pages of propaganda from the CDC and elsewhere to propagandize these judges. I got all sorts of internal documents showing how effective it was. The justice system was completely corrupted and broken during COVID. That led me to start looking. And what I've seen is across the board, and not every judge. We have wonderful judges. We have great justices out there that are brilliant and amazing and great lawyers out there. But we also have some dirty, dirty animals, just like you have in healthcare, just like you have everywhere else, that really are a stain on the profession. And it's an absolute embarrassment, in my opinion. And I mean, listen, we got to clean this up. Right now, there's no accountability for judges or prosecutors. And until such time as we find a way to ensure accountability for a corrupt judge or prosecutor, it's going to continue.
And do you have a plan for how we go after this?
This is one of the most difficult areas that I could come up with to address. And the reason for it is that if you make it easy to go after a judge, then the judge can't be impartial. Right? So you can't make that an easy thing. It's got to be a very high standard. But right now, the only theoretical path to go after a federal judge is to file a bar complaint. But I can tell you firsthand that there will be retaliation if you do. It doesn't matter how corrupt that judge is, there will be retaliation. If you file a bar complaint against the federal judge,
I got to tell you,
good luck.
The most disturbing thing about your profession, and by the way, thank you, your daddy, for the super chat. The most disturbing thing about your profession, that I've always thought this, my profession, we police the crap out of ourselves. And if we're not policing ourselves, the state does it for us in very, very aggressive ways. Same thing with nursing.
Yeah.
Nursing board is extremely aggressive at policing the profession. It's always seemed to be the legal system does nothing in terms of policing their peers. And I think you could start right there.
Well, it's an old boy system. I mean, it really is. And, I'll be looking for my bar complaints after this interview because that's the only way you get a bar complaint or get anywhere with it is if it's against someone who's speaking out against the issues that we face. But I'll be honest with you, Drew, I'm at a point now in my life and in my career where I've given everything there is to give on this justice fight, this truth fight, and I just don't care. Go ahead, bring it. We have got to get reform. These federal prosecutors that we saw, particularly under the Biden administration, but we still have a bunch of them there. We haven't cleaned house. We got some of these guys, to my mind, they corrupted the system in ways that I can't even fathom to this minute. We see federal judges, Tom, that are.
For me, for the people that don't know what you're talking about, I always point at Martha Stewart. Martha Stewart set up her employee option plan. I sat at dinner with her and said, I'm just taking this public and setting up an option plan for my employees because I want them to participate. They've worked so hard. And she did nothing wrong. She did nothing wrong, but they went after her and they finally found an inconsistency in her testimony and said, aha, you lied to a federal prosecutor, which of course, She's like, what? I forgot, or I misspoke, whatever. And they'll find something. To me, that was a great example of how they will just go until they find something. Same thing with malpractice, by the way. That's why I'm so used to it. Malpractice, they'll find something. They can always find something.
Well, malpractice is a real interesting one. That one, so I don't know the Martha Stewart case that well, but you're right. First of all, let me address that first. Yes, you're right. Okay, so you 100%, if you give the DOJ a task, they're going to find something, and they can do it every time, no question. And with enough budget and enough time, that's why I say funding is the great determiner in terms of justice, right? So justice should be blind, but it should also be blind to how much money you've got, and it's not. The DOJ has the most money, so the DOJ wins every time. Now, with regards to malpractice, because I know you'll love that one, because all my doctor buddies love it when I talk malpractice. So malpractice is an interesting thing because, listen, it's abused because we got ambulance chasing lawyers who are scumbags who will abuse that system on a profound level and take a doctor who was doing everything they could to do right and, miss some obscure standard and this, that, and other. And now, does the patient have a right to be made whole on that? Well, yeah, if you make a mistake, they do. But there's a difference between that and a bazillion dollar punitive damage case, where you're paying out a doctor who just made an innocent mistake as the most evil man on the planet. Now, that said, we have a number of states, and I can talk about this because of COVID. And I think I talked to you on one of the shows. I have a recording of a nurse who during COVID talked about her floor being the murder floor, where they bring COVID patients to kill them, right? They knew that the protocols that they were using were killing patients. Everybody knew that running the vents the way they were was dangerous. I mean, the protocols for vents were well established for years and years and years, and they overpowered the vents to cause the pneumonia, to kill you so that they could blame it on COVID pneumonia, which it wasn't. It was vent damaging your lungs in many cases, not all. But so you have things like that happening. Now, here's the problem. When you have malpractice reform, you have the same situation that you have with vaccine immunity. So there's a number of states where I was asked to look at cases where, because malpractice reform had gone so far the other way, there were legitimate. I had a case, and I can't give the details of this away, where an individual decided he was going to leave the hospital. He had COVID, and he got up to walk out. Someone gave him an injection. He woke up a week or two later with a vent and half dead. He was not on a vent, nothing like that. But they put him out. And while he was out, they gave him God knows what. They did not. But I mean, this was manifestly evident. It was very, very clear what happened, right? And I could show this without any doubt. But because of the way the malpractice rules were written in that state, along with all the protections that come with COVID, I literally couldn't do anything for this guy. I had nothing. Nothing. So I mean, I get it. They go too far. There's got to be a reasonable middle ground where if a doctor is doing something wrong, you hold them to account. And sometimes you got to make an example of someone because otherwise someone else will do it. But we also need to be prudent and reasonable about what we're doing and not so driven by money, because our money chasers are really not any different than big pharma. They don't care about the damage they do as long as they get the paycheck.
I'm looking at the Rumble Rants. Dab 30 says high flow oxygen provokes the same ARDS symptoms as COVID. Yes, it causes the same injury that leads to ARDS. So both high pressure and high oxygen, which were things that people were doing weirdly. This is, again, the behavior of my peers during COVID was odd. They would take people, they called them the hypoxic happy or something, because they'd have a PO2 level of 85 or 82, and they'd be like comfortable. So they'd slam that person on a ventilator, and you couldn't get their O2 up without high flow O2, and the lungs were a little stiff because of the pneumonia. High pressure now, boom! Now you've injured somebody. Now it's on. And yes, Dab, you're absolutely right about that. Well, Tom, listen, this is always so interesting to talk to you. I don't think you and I can solve it today, but I do, as always, admire your work and your persistence,
openness.
Yeah, you're willing to argue about stuff, which I love.
We don't have to not talk about something.
Right, exactly. We just talk about it. And I would love to support the reforms that you're talking about. So for me, as I leave this conversation, the reforms of lawyers and the judiciary, however you think that should be done, I'll support. And then please get at the medical publications. That is where things are really adulterated. And I heard RFK Jr. saying he would not allow any NIH-funded studies to be published in the majors unless they straighten their shit out. And that to me was hopeful, that kind of thing. So I feel, go ahead.
If you know David Weissman, he's done some incredible work on that. There's a bunch of people. My friend, naturopath Pam Popper, and David Weissman did incredible work on the issues with the journals. I mean, you're right. It's a critical issue. And unless science is actually science again, we're never going to fix any of the stuff in healthcare, because right now science is fraud. And as the WEF said so proudly, we now own science. The WEF, the WHO. Because Google said that, we're going to just trust the WHO, we're going to trust this. So they own science, and see where we are.
Well, I thank God we live in a free society where something like Grokpedia can step in to replace Wikipedia and hopefully get at something that approximates the truth. Was it you and I were talking about the truth at the beginning, the truth being under attack? And I could not agree more. The truth is in jeopardy, and the truth matters. It needs to be protected as thoroughly as freedom.
It does. It does. I mean, listen, free speech, truth, and honestly, I wish if we had another hour, we could talk about all sorts of things that you're not supposed to talk about. I got a couple real barn burners. The free speech thing, especially in light of what happened with Charlie Kirk and Bondi out there saying that hate speech isn't free speech. Newsflash, under the law, under the Constitution, hate speech is 100% protected. It may be reprehensible and you may be a scumbag for saying it, but you have the right to say it. But remember, they told us we didn't have the right to say that masks don't work. We didn't have the right to say vaccines might have dangerous side effects. We didn't have the right to speak out on all sorts of things. They criminalized against it. We can never allow speech to be criminalized or abridged because it's called hate speech, because who gets to decide what hate speech is?
Perfect place for us to roll to a stop. And it's such a clear mandate, which is protect speech. Tom, as always, we appreciate your work.
Come back soon.
Appreciate you joining us. It's been too long. Come back soon. I'm guessing people love what Tom's saying and stuff. I haven't been able to keep up with the rants and the restreams and stuff, but
they all stuck with us. It wasn't. You don't have to be a head of state. You just have to be Tom Renz.
I don't think your mic's on.
No, they're here. You don't have to be a head of state. You have to be Tom Renz.
They feel sorry.
I hope you're collecting. Are you collecting a little army of attorneys? Do you have other people that are kind of coming on board?
Oh, I've been able to. It's crazy. I can actually get a meeting with a lot of people these days. It's a crazy thing the way that works.
Be careful. Swalwell will come after you. Be careful what you say. Well, Swalwell will get you.
Hey, they've already. This is an honest story, Drew. During COVID, I had a guy show up at my house, follow me to the gym, knock on my window, and hand me a packet. I had pictures of my family sent to me. We had some real serious threats and some real scary things come.
Yeah.
I just, for the first time, by the way, I'm going to do this if you'll let me. I know we're out of time, but if you'll let me, givesendgo.com/RenzLaw. We just got hit. It's the first time anybody's ever been able to make a sanction stick on me. And so we're looking for donations on that. Anybody that's willing to help, I'd be grateful. We need to raise a lot of money real quick. I've been under attack for 5.5 years now, ever since I decided to start doing this. You just get to the point where it's just par for the course. It hurts. You take a lot of arrows, but you keep marching for the truth. And you look for guys, honestly, not to kiss your rear or to plug this, but support the Dr. Drew Show, because Doc, you're mainstream. You talk to both sides, but you're willing to let me speak. This is what Charlie Kirk died for. This is what people like me need. I need to be able to talk to people that don't agree with me 100% of the time, but that I can make my points and let the best argument win. Let the best argument win. I don't care who it is, but let us exchange information. And God bless you for giving me a platform to do that with you guys. I love and appreciate this show.
Well, and you have not ever let us down. You've always said something interesting. And as what my sort of commitment to the show is, talk to people I disagree with or have been canceled, whatever, because I always learn something. And talking to echo chambers is not how you learn. Sorry
about your sanction. I don't know what that means, but where did you want people to go?
Give, Send, Go. It's up on the screen, Susan.
Oh,
Give, Send, Go /Renz Law. Okay. RENZ Law, is that correct? RENZ?
Yep,
yes,
that's correct. That's it. Okay. RENZ LAW, and we appreciate anything you can do on that. Like I said, that was a big kick in the rear because I had 7 attorneys from around the country testified that I did nothing wrong in that. And when I finished my 6-hour testimony on the stand, the opposing counsel declined to cross-examine me and withdrew their evidence. There was no evidence on record, in my opinion, that at all that we did anything wrong. But yet the judge went ahead with it. I'm not saying there was an issue there, but So listen, we've had a lot of stuff like that, but this is what happens. And you know the real kicker on that one, Drew? You know how much I charged for that case? 0. I did the case for free. I didn't even request legal fees if we won it, because I was just trying to help some small businesses that were shut down. But this is like we talked about with issues in the justice system. They exist. They're real.
Tom Renz, thank you for joining us.
Thank you, sir.
See you soon. All right.
We have a weird schedule coming up.
We have a what? A weird schedule? Yeah, because we have Monday at noon, I think, or something like that.
No, Thursdays at noon. I don't.
Okay, Monday is 2 at 2 o'clock with Leland Fittert. There it is.
Tuesday is at 12 p.m. or 2 p.m. Right?
And we don't have do you have the guest yet for that October 9th at 12 p.m.?
Not, I don't believe it's confirmed yet, because some things were being moved around because of travel and stuff that you're doing that week.
Viva, Navarro. It could be Viva, it could be Navarro.
Peter Navarro maybe that day, but okay, we'll get into more stuff. All right.
No, that's a crack producer, Emily Barsh question. And by the way, we want to give a shout out to Emily Barsh for producing this show. We have to add her to the credits at the end of this show every week, because I've been meaning to do that, Caleb. We have to add them on.
Oh yeah, she's in the credits. I just got to get the audio updated, but it's old. It's from our old mics anyway. I'll get that.
Drew's got to tape it. Yeah, tape it a new ending. But anyways, just remember Emily Barsh.
Appreciate it. We appreciate you guys all being
tirelessly behind the scenes.
I just our little team here is the little engine that could. We are a fierce, mighty fighting force here, and you all are the ones that support us, and we're able to do this because of you.
Followers today for watching.
Yeah, so that was a longer show than usual, but interesting and lots of good guests and stuff. So it's worth it.
Yeah, and also since Tom Renz's name is in our headline, if you like us on YouTube, that'll help our algorithm over there. I don't know what's going on today, but also everybody on X, thank you for watching.
And you said, Caleb, you put us up on TikTok and people start having strange reactions there?
Yeah, probably about 1 episode a week. I turn on the switch to turn on TikTok if I'm feeling, extra, like I need to get some energy out and confront some people. Yeah. Feeling extra charitable and want to get into some internet troll fights and stuff. Yeah. That's my baby yelling at my door.
It's China, Caleb. Just remember.
Do many people show up on TikTok?
Yeah. And it's so interesting because it's like, think about the audience on Rumble and then go to the exact opposite of that. And that's 90% on TikTok. And then after a little bit of time, then the real people that actually follow you and are not from like their random algorithm page come in, and then all the comments change and they're all of a sudden they're positive and people that are interested in science and things like that. So I'm trying to help and trying to, really to reach the lost here,
Yeah, Caleb's young. He wants to keep pursuing TikTok. But now that I know it's going to be 80% American investors over there, I'm feeling a little bit more worthy of going into TikTok again.
As long as it's not China, Susan's okay.
I think they watch me. I think China's watching me because I don't trust them.
I'll get her on some medications soon. So thank you very much all for being here.
Haven't you noticed though, TikTok will just pop up on your phone and like say, oh, you need to look at so-and-so. It's like, leave me alone.
All right, everybody. We appreciate you all. Let's see what Caleb, what did you put up there? Caleb? Something
that I
you.
must have been on TikTok yesterday. So I forget what I must have ranted about yesterday, but I must have had some rant because I've gotten a bunch of comments about it. So I'll have to go back and see what I said.
Oh, you did?
I like TikTok. I think it's kind of fun. But in any event, thank you all. Appreciate it. We'll see you. Is it now Tuesday? Monday? Hang on. I'm being weird here.
It's Thursday and the show's on Monday.
Oh, Rampart said, Dr. Drew, you got me into bone broth. Okay,
I saw that.
I am so excited about the turmeric ginger because it's like a soup and it's so...
you know what? I took a picture, Susan, of their recipe. So I'm going to tell you what it is now. It's turmeric ginger, warm milk, ground cinnamon, honey or maple syrup.
Which sounds interesting because it has a ramen sort of flavor to it. So you could throw some noodles and vegetables and a little bit of meat, and you can make a ramen.
Made, right?
It was so good. I put it in the lamb ragu I made last night. I hot potted lamb ragu and I threw a
Salty
scoop in.
fans, I see you there. The Salty must be coming up now because the rees are going crazy. So let's get people. He's later in the day though, I think. But anyway, Salty's coming on our show sometime soon too.
Caleb, we need some kind of a way to direct people to what our schedule is coming up on the website.
That's why
Do
they
we
know.
have that?
Yeah. Well, that's why they know. Well,
the reason I'm running for the door is I really...
You have to go to the bathroom?
I really need to go to the bathroom. And you guys keep interrupting me. I'm trying to wrap this thing up. It's been longer than usual already. It's been almost 2 hours. You gave me this giant cup of coffee, and now you're blocking my route to the bathroom. So, with the bone broth, by the way. Thank you for that. Appreciate everybody. We will see you Monday. Let me look at the time. Monday, I see it as 2 o'clock. Leland featured. See you then.
See you then.
Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.